hopefully this will be of interest to you. So some will be familiar and it'll be interested to you. Julia, I know, has come across Amatsu because Julia's actually had a session with me.
It's beautiful.
Thank you. So some of this will be familiar, obviously, but nobody knows what it is. And these are the type of questions I get from people. So is it from the Far East? Well, yes it is. It's got its origins in Japan. And as the lady said, is it like shiatsu? Well, shiatsu is a physical therapy, yes, so Amatsu is a physical therapy. Its origins are in Japan in exactly the same way. Shiatsu is based on acupressure meridians and it uses pressure. So all those things are true of Amatsu. Acupuncture informs how we work and we can often make some interesting connections that other therapists wouldn't make. But the pressure side of it, we do use pressure, but it's actually how I elicit the change in the client that makes Amatsu different and quite a powerful therapy. So, so it changes on there before it changes on there. That's very strange. So, it's a hands-on bodywork therapy with a therapeutic touch. It's actually, as you can see, I've got a few pictures of different moves in using Amatsu, and it's fully clothed. It's a fully clothed therapy, so it becomes accessible to quite a few people who actually wouldn't consider any kind of body therapy. So they're missing out on a. I'm not saying anything to get massaged, sorry, but some people don't want to take their clothes off, do they? And so it makes it very accessible for other people. We usually work with our client lying on the couch, but because of the way we work, we can work with our clients sitting or standing, whichever is comfortable for them. So if we're working with, say, pregnant ladies, they can sit and we can work. Some older people are not happy laying down and they find it difficult to get on and off the couch, so again, as long as they can sit in a chair, then we can work with them. I've also got a client at the moment who's so uncomfortable in her lower pelvic region, she actually can't sit down. So I'm actually working with her standing up at the moment. And hopefully we'll get to the point where we get her much more comfortable in her undercarriage and she'll be able to sit or lie for me. So because, as Tim said, it's a very gentle therapy, it's useful for working with babies, all the way through to people at the more frail end of our age generation. It's a very privilege to work on babies. Working with babies is very different. Because of the way we work, it's a very natural movement. We basically just support the baby, hold the baby, and they move in a very natural way and they self-correct. And it's actually wonderful to see. And we can help with interesting, very common things like colic. You probably saw a lot of babies in your clinic with colic. And the vagus nerve sometimes gets, if they've had a difficult birth and their head is twisted, the vagus nerve gets just trapped just behind the ear. We basically just release the cervical vertebra and how the head sits on the vertebra. And you have a happy baby, and it's lovely. So babies right up to the other end of the scale, so I'm working with a 90-year-old lady at the moment, and she's loving it. Very good for pre- and postnatal body work, and everything in between. So, everybody ready? So we are balancing the body by adjusting the support, so we're realigning. Now, we're not looking for our perfect template, we're looking at what is functional for you, so how you're comfortable. So if I sort of take you through a simple analogy of a tent, I need to use my hands now. You've got your tent pole, very simply, and your guy ropes. So any of those three things could, obviously the body's a lot more complex than that, but any of those three things could move. So the tent pole could drop, one of the guy ropes could come loose, one of the other guy ropes could. So we're always looking for the pull in the body. So Our human body, obviously, is much more complex than that, and so we've got a sort of very much 3D effect going on. And often in a torsion, there's what we call a tourniquet tug, where things are rotating. So we're actually taught to assess the pull of that torsion and unwind that torsion for our client. So we're looking at all structures in the body: muscles, ligaments, bones, and fascia. I hope everyone's, yeah. If I use any words that are like peculiar, you will ask me the question. And what makes us different is actually how we work, how the practitioner works, and we use taijutsu. Taijutsu is translated as integrated natural body movement. So, integrated natural body movement, taijutsu, comes from the martial arts practiced by the ninjas. So the ninjas practice their ninjutsu, and within the ninjutsu there are 18 disciplines. Taijutsu is their unarmed combat discipline. So they have other, like horsemanship and swordsmanship and so on and so on. And ninjutsu is a complete fighting system. So it's physical, mental and spiritual, they're all taught. So it's a method, taijutsu then is a method of moving and thinking. So it's the way we move and the intention that we use with our movement. So my integrated natural body movement restores your integrated natural body movement so that you've got use of your whole body. And the sort of martial principle that some of you may be aware of is the opponents, you match your opponent, you match the movement in your opponent, so read client, and you join with their motion, and obviously the ninja is looking to defeat you, but as a healer, as an Amatsu practitioner, I'm looking to help you restore your natural body movement. So I'm harmonising their movement with intent. And in the martial sense, they're redirecting their opponent's movement. In the medical sense, we're using change to heal the body. So less force is used to change the direction of something that's already moving than something that's static. So we use the client's movement to help us. So with any tension, there's a torsional direction, which is an imbalance or a pull in the body. We follow that direction, and as a practitioner, I'm walking alongside you to help your healing. So I'm working with your body. And I think that's the beauty of Amatsu, that it's effortless for me as a practitioner, effortless, because I have tissue rapport, so rapport with your tissue, I join with you. And we don't use force at all. We actually use the spiralic movement that you can see in this lovely picture that my son found for me. As you watch the flowers unfold, you'll see there's a spiraling movement. And it's a movement that's found everywhere in nature. Everything that's growing and moving moves and grows spirally. And it's irresistible. You can't stop a flower from blooming, a rose from blooming, or a plant growing. And that's how we work, using that. Now these movements are also used in various sort of sports. So climbing is a very whole body movement coming from the spine. Sailing is another one, and obviously the martial arts. But I've just I treated a man yesterday who's a tree surgeon. He spends a lot of time climbing trees, and that's another body movement that is an absolute full body integrated natural movement. So that was great. It was really nice to see him. And so because it's sort of based in nature, the ninjutsu school is Hichibuku Goshinjutsu, which translates as the secret flower opening school for the defense of the self. So that's the where medicine and martial are treated. They're taught hand in hand alongside each other. They're one and the same. And for self, so when they're saying defending the self, it's defending your health, and that's how the martial artists are working as well, defending their self. Well, have I lost a card here? Let's see what my next. So yes, that's what I was going to say. The martial side of it actually joins very well with my Amatsu story, how I came across Amatsu. So I just thought I'd take you through how I found it, because it's as nobody here, well, apart from Julie, has heard of it. Although I don't think you had when you came to see me, had you? No. So yeah, no one's ever heard of it. So it's how did I come across it? So when I left school, I qualified as an accountant, and I worked in the city, bashing a computer screen. Actually, I started in ledgers. That's how long ago it was, writing in ledgers. Yeah. Until I had my first child, lovely Gareth, there in 1992. And I went back to work. I did actually go back to work, but I kind of lost my heart for it. And my priorities changed, really. And then when I had Jamie in 94, I actually decided to have a career break. So my lovely husband decided he could support us all. And I began my search for my purpose. What was I going to do with myself? So I looked at all sorts of different things about becoming a mentor to pupils at school. I looked at speech therapy, and I did go actually and work alongside people in orthoptics up at Moorfields Eye Hospital. I was interested in, but nothing sort of really quite fitted actually. And I actually found Amatsu by accident, as most people do. And really, all my boys play football. They all play football. So inevitably, we get the odd injury. Jamie actually plays quite a high level. He's 22 now and still playing. That's lovely Jamie there. And so we would go to a sports... Oh, hello. This is my husband, as you can probably see. He's coming on to help me with my demonstration later on. So we were introduced to a sports injury specialist in Winchmore Hilton. He's actually still there. And he was, he's a very interesting chap. I told you about him, didn't I? He looks at everything. He's very interested in researching all sorts of different things. And his latest passion had become Amatsu. And so he asked me if I would be interested in being a case study for him. Because whenever I took the boys for a treatment, I asked loads of questions. I want to know what you're doing with my children. And he thought I would be interesting as a client as well for him to work on. Because the sort of symptoms I had nothing really debilitating, and I actually didn't think there was anything wrong with me, actually. I just thought, I was getting on with life. But I had a stiff right toe, one of those things. I mean, I didn't even think about any of these things. They just annoyed me from time to time. I had a dodgy knee, and actually went to a specialist, and he was quite keen to operate, but I wasn't very keen for an operation. So I was just using Pilates and physiotherapy and all sorts of things just to keep myself going. I had a lower back issue, probably left over from pregnancy. I had a good neck, headache, right shoulder, you know, and these things still do plague me from time to time. But his first session with me, remembering as a first year student, I had one session with him and I felt amazing. I'm not saying that happens every time, but I just couldn't believe the difference that the one session had made to me. And all these sort of seemingly unrelated symptoms were all connected to a problem that I had in this area here. I've got a really unpleasant appendix scar, and it was interfering with my large intestine. And so my lady bits were having a bit of a problem. And because I'd been opened up, I'd lost my pressure in my abdomen, so my liver had dropped and my shoulder had come down. And all sorts of sort of connections, and it was just unbelievable that he could correct my posture from this one place. And I felt amazing. Didn't last very long, but so it was quite interesting. So then began my my journey to Amatsu. I decided to train, and I've been working in Palms Green, which is where we live, with clients since 2009 now, and running quite a busy clinic there. Well, anyway, if anyone wants to talk to me about it afterwards, then it's changed my life from accountancy to body worker. So where does it actually come from? It's a comprehensive system of Japanese natural medicine, and this is Dr. Matsaki Hatsumi, and he's the current Grand Master of the School of the Opening Flower. So he teaches taijutsu, and he's actually a Japanese osteopath. That's his training, and he's actually been Hatsumi's actually been given life membership with the Royal Society of Medicine, and he's got a permanent inscription of his name on the Wall of Honour in the atrium of the headquarters of the Royal Society of Medicine. So he's made an impact over here. So he and these three chaps, Dennis Bartram, who is my teacher, Chris Roworth and Billy Doolan. They were three osteopaths who were also interested in martial arts, and the three of them went over to Japan to train with Hatsumi, and they were all very interested in the fact that they teach the martial and the medicine side by side, and he was able to make very lasting, very quick one-point corrections on any of his students who got injured. So, being interested men, they cajoled and persuaded, and Hatsumi agreed to train them in his feeling. So they would learn in a martial context as taijutsu practitioners, and then translate that feeling into the therapy. So in terms of the taijutsu, we're using relaxed, continuous body movement. So we've got a never-ending supply of counter moves. So with an opponent, you're looking at counter moves to defeat your opponent. But with therapy, we're looking at an infinite number of possible directions that you can allow your client to release back to their neutral state. So that's the theory behind it. And then Dennis Bartram, who's been most active of the three of them, he's then done a lot of research. He's another man who can't sit still. Lots of research. He's added on to his knowledge of osteopathy and martial arts, the anatomy and physiology that we all recognise in the West. And it's actually him who's developed this Amatsu treatment so that it's acceptable in the West, by people in the West. So it's been available in the UK since the 1990s, and there are 80 or so practitioners in the UK now, and we're a sort of growing number. So Hatsumi taught the feeling behind the martial principles. Then we've got the Western anatomy and physiology, and then Dennis is continuing to research, and he's got in contact with, or he's found on the internet, you can also Google this word biotensegrity. Now that's a sort of a current research that's coming up, and Dennis feels that biotensegrity actually explains what it is we're doing and how we're doing it. And there's a chap called Dr. Stephen Levin, he's an orthopaedic surgeon. Have you heard of him? No, okay. And he sees himself as a body mechanic. He operates on the spine. And he was looking at the spine and thinking, this doesn't work in the way I think it does. It works. And he formulated an idea of how he considered the human body worked using these biotensegrity principles. So this is an example of these two here are made by a chap called Tom Fleming, who's actually a toy maker, but he was also interested in body movement, how our body moves. So this one here is a toy. So I just call it my tensegrity toy. This came from John Lewis's. And the human body is made up of icosahedrons, right down to the cellular level. So this is a sort of an idea of what a pelvis looks like. So these are your two legs, and that's your hip bones. So just as an illustration, it's not a static thing. This is the spine as well. That's actually a 3D. In fact, Dennis has actually bought that. He's actually got that. But you can see with this, you can come and have a feel actually as well if you want to. If I move any part of this, the whole thing, everything changes. Every part of it is affected by anything that I do. So if I'm lift one side or this side, everything changes. Every part of this is affected by anything that I do. So this is basically how he sees, it's a very simplified version of how our body works. And he coined this phrase, biotensegrity, three words all together. So we've got the bio part, which is obviously biological, that's us, tensile, and then integrity. So integrity is a whole unit or a structure or a building, so one wholeness of something. Tensile is self-supporting. So my husband's actually an engineer, and we've spent many nights debating about biotensegrity. But he explains to me about forces of tension and compression which are in balance with each other, which allow something to stand up. So Brendan designs buildings that stand up. Now they don't look very biological, do they? But if you think about, everyone's probably familiar with the Eden domes. Everyone's seen those? They look a little bit more biological, don't they? You know, maybe forming from nature, but they're still static. They're still static. They don't move. Now we are dynamic. We're moving around. You know, I'm moving around all the time. Yet I don't fall over, and I still maintain my structure. So biotensegrity was we're moving as a whole unit. So as a practitioner, I can't work on one part of you without affecting the whole of the rest of your body. So that's the theory behind, or the principle behind how we work. So how do I find this correction point? I explained earlier that there's a very close interconnection between martial and medical, and between hurting and healing. So this is a samurai warrior. And the Amatsu, or the idea of a one-point correction, came from... Sorry. There's a lady started already before you. It came from the the ancient Japanese samurai battles, and they needed to get their warrior either up and out or up and fighting again. So in a martial sense, they were looking at their bodies, and you'll see within this young man here, there are various points of vulnerability where opponents would be aiming for. So his feet, his ankles, all the areas where you need to move. So knee joints. So he's got no armour covering these, backs of the knees are very vulnerable. Under the arms, he needs to be able to move his arms up and down, so he needs space and flexibility there. The elbow joints and the wrist joints, all around this area, he needs to be able to look from side to side. So all these areas are very vulnerable for the warriors to get hurt. And what they found was that these are also excellent areas for healing as well, for helping the body and getting you back to your place. So what I'm looking for is a kyushu. Obviously that's a Japanese word again. But it's a point of critical change. Where do I have to touch you in order to release you back to your neutral position? So I'm using movement, and I'm inducing movement in my client to facilitate this whole body integrated correction. So we achieve a much deeper correction than a massage. I shouldn't say things like that, should I? We're working, in fact you probably do make much deeper changes than you think you're doing, and I'll explain that as well actually, because so we're looking for the opportunity to make a change. And we find that correction point by using skin drag. Is that something that you would... do you notice points where you stop on a client?
Yeah.
Yeah. So for us, that's a possible point where we could make a change. Yeah. And then you use pressure, don't you? And then with the pressure, you get a movement. And then you're actually affecting, using our intention or our understanding of our principles, you're actually correcting the whole body and having an effect on the whole body. So, so with my tensegrity toy, it's quite difficult to do, but if you can see, something, if somebody comes in with some kind of thing like this, the obvious place then is to press here and bring it back to its neutral place. That's a little bit simplified, but we're looking for an adjustment to make in a person's structure to allow things to, if you remember your tent pole and your gyros, allowing it to come back to neutral. So there's a law which we study, which is actually called Wolff's Law, and what it says is, as above, so below. So if you can feel something above, what you're actually feeling is right through into the client. So everything has an effect on the surface. And so if something's happening inside, underneath, is going to have an effect on the outside. And, as healers, you can find these areas where it's showing on the outside. So we can make a difference on the outside, which will affect the inside. That's how we work. And our fingertips, I'm sure you all know, are very, very sensitive. And you can feel tiny, tiny... There we go. Very small changes and differences. So in terms of how Amatsu works, the practitioner's movement is actually essential to how the treatment feels for the client. From our very first touch to actually making the correction. So we're working with the client to free off restrictions in their body and allowing them to return to neutral. So we don't use force. It's almost like coming alongside your client and taking them with you. So you find your you're finding your skin drag place, and you can feel the torsion in your client, which is the direction in which they're already moving. You meld with that movement, and then change your direction. So you're offering different directions to the body, and the body either accepts or rejects. So that's why it's very gentle, because we're just offering. And if it doesn't take it, then you find you go for your infinite number of counter moves. You know, so we are actually thinking in sort of martial terms, but trying to heal at the same time. And then, so once I've done my, once I've found my 1 point correction, my kyushu, and made that correction, I then integrate the rest of the body into that correction. And what I'm looking for with my correction is to actually work from a place that's furthest away from the point that needs changing, because we want to make a very small adjustment, a very tiny move that the body is going to accept. And it almost works like a whiplash. So if I make a very small movement here, I can actually produce a very big movement at the end of my hand. But we're actually working minutely down in this sort of distance. That's why Brendan says, you know, you're not going to do a demonstration or it's like watching paint dry. It really is. You're standing there, you've got your fingers on maybe a foot bone. So I want to be as far away from the area that I want to correct. So say I was going to correct around this area, I'd probably work from a big toe. So I'd get hold of my big toe and I'd be offering different direction. I could feel the pull on the big toe, where it goes to, and then offering different directions, and then joining the rest of that, integrating that into the whole limb. And then I know that I've got a stable pelvis. I then work with my other limb, the other leg, transfer that all the way up the spine, 2 arms, and the head. So it is a full body treatment. So we also are informed by this lovely flash stuff that my son does, by the Godai, or the Big Five. Now the the Japanese have a word called the Gauron. I don't know if anyone's ever heard of that. And it's a principle that the Japanese, it's the interconnectedness of everything. So I guess as healers, you're all, you know, very well aware of that. And within the Gauron, we identify the Godai. And the Godai translates into the Big Five. And it's the Big 5 things that make you you. It's the Big 5 things that affect you and influence your life. So we can maybe just take a very obvious example here. Say you fell over and you broke your leg. So that's physical. It's a physical thing. So you'd be in a lot of pain. So you've got an electrical impact. So all these things are interrelated and interdependent. So for a healthy person, there's balance in all of those. They're equally balanced. So if something goes out of balance, so here we've broken our leg, physical has come out balance. So we've got our electrical effect on that, which is the nervous impulses, with your pain, stimulating the nerves. You may take some painkillers, so you've got a chemical influence then on your health and well-being. And then you may not be able to go to work, you may not be able to go to the shops, you may not be able to look after your children. So you've got an environmental effect. So it's where, when and how you do what you do. And then perhaps if you're at home and feeling very sorry for yourself, emotionally, it's going to affect your thoughts and your feelings. So all of those things have an impact there. And that's a very obvious example of something, you know, a broken leg. Maybe if we look at something a little bit more subtle, like stress that people have. that affect us. So stress may be coming from your work, or it may come from your home life. You may be in a difficult position, maybe caring for somebody who's ill. So you've got a stress there in your environmental area. So that's going to affect how you think and feel, your moods, your thoughts, and your beliefs. So there's an emotional impact to what's going on for you. You may turn to alcohol, or cigarettes, or antidepressants, or you may care for yourself by eating too much, or eating the wrong things. So there's a chemical impact there, and obviously then that affects physically how your body works. So we're looking. So when all these things are very interesting to an Amatsu practitioner. So when I'm talking to a client, I'm listening very carefully to what they're telling me about their lives. And Amatsu is a physical way in to this imbalanced go-dai. So we use that physical way in to restore the balance of all the other aspects in your life. And I've seen people make amazing changes in their life. Once they feel physically well, it impacts on all the other aspects of their life, and they make amazing changes. So I see myself really as a catalyst to start things off for people. And they often, come to me for treatments for not a long time, and they're in a better place, and they're able to make the change that they needed to make, say, in the work environment. They make that change, and then everything else in the go-dai settles itself down into that balance. Oh, gone again. Will it come back?
It will, yeah.
Oh, yeah. Oh, have I gone? All right, we're moving on. Moving on. So, what does the treatment involve? It's about an hour working with a client. And first I would take a history from my client. I talk to them. I actually have a consent form for people to fill in, and with lots of questions, tick boxes, and then depending on which boxes they tick, we have a conversation. So I look at what they present with, so if it's a broken leg, or headaches, or lower back, or whatever they're actually physically presenting with. That's interesting to me. But the rest is also interesting as part of their go-dai, part of their life. What makes them, what's brought them to me. So then I would do a physical assessment, so they would lie on my couch if they're able to lie on my couch. And I first observe. So I'm looking at their body and looking for how left and right matches. So I'm observing. I'm making an observation of the asymmetry that they may have. So if someone's come in with a swollen knee, I can see that one knee is bigger than the other. And obviously they probably would have pain there as well. I might ask to look at a particular area of the body. Usually, that the client remains fully clothed, but if you're okay about me looking at the area that hurts, that would be useful. And sometimes I might want to feel, so I could feel heat, or swelling, or you can see bruising, and so on. So you're looking. Then I'd ask to look for a range. I'd be looking at the range of the joint of the person. So I'd ask them to show me first, and then I might feel the quality of movement in that joint. Then I do a series of muscle reflex tests. So they're not a test of strength. It's a test to check whether neurology of that muscle is firing. So it's a very quick test, and it's very light, and often people say, I can't feel what you're doing. But I can actually feel in their body how that's working, and it's literally very quick. So you want your muscles to be able to fire without conscious thought. So as you're walking down the road, you don't think, oh, I need to contract this muscle and relax that one, and then I need to lift this shot. You couldn't get down the road like that. So we want all our muscles to be firing in a reflexogenic way. So we're actually testing reflexes in that, and we want to bring that back to, you're nodding. Yes. Okay. So we've got a series of about 55 muscle tests, but I would select ones that were specific to that client. And they wouldn't necessarily all be in the area of complaint, because I'm looking at the full structure of the body as well. And I also use orthopaedic tests, so probably orthopaedic tests that you would know, and John as well. We're familiar with all the orthopaedic tests. I actually don't like the ones that cause pain. I feel I can find another way of finding out. But if people come to me and they say, oh, I've had a positive Babinski, I'd know what they were talking about. So we work with all of those as well. So they would probably be familiar to you if you've been to a GP or a consultant. They'd be exactly the same tests that we use. And then moving on to the actual treatment, I find my Kyushu, or my priority, the place where I want to make my point of critical change, where I can release you back. And then I use mobilisation and massage to ease off the tissue around any joints that have become restricted or uncomfortable. We use acupressure points to clear the meridians related to any of the areas that are a problem. It's quite interesting actually, the muscle reflex tests we use are all related to the acupressure meridians. So, just not used to it. I should probably I could change the timing, couldn't I? Yeah, but I don't know how to do that.
It's on the
another time.
Yeah.
Another time, yeah. So the acupuncture meridians that inform us of what's going on, we can narrow down our treatment to particular limbs, maybe particular organs, even particular vertebra. And we get information from the client about their emotions, and all this feeds into our treatment. So I'm working mainly body. We would either probably work, 9 times out of 10 you're working from the feet up. So we give the client a really stable foundation with a balanced pelvis. The spine then sits comfortably on the pelvis, shoulders are poised and the head is light, weightless. So we finish off then, so we've worked the whole body, and then we finish off with our cranial balancing. So we finish with a cranial section. Then I would reassess any of the tests that I've done before and note the improvements. And then I can give, and some clients are interested in I give self-maintenance to people anyway. Some do it, some don't. Some ask and don't use it. But I do find that people who do the self-maintenance that I give them, so it keeps them in balance for much longer, and their improvements are much quicker. And they're just, they're not gym things or anything, they're just very ordinary things. One of the things that we recommend to people is walking. Walking is by far the best thing you can do, and you can walk in a stable pelvis if you do enough of it. So I thought I would just tell you a little bit. Oh, now this is a very short video of I need to find where my I need to go back. very short video of a treatment. And we've just got like time-lapse photography taking sort of 3-minute video, little bits and pieces of how we would work with the client so that you can see. We don't use all of this on everybody because some people wouldn't be able to move in this way, so don't get alarmed by some of the movements. But there's an illustration of virtually everything that we work with. So, I don't know if you want me to talk while this is on. Is it happening? Doesn't look like it's coming up, does it?
Like a slideshow.
It's just pictures.
Mm-hmm. Is it?
Oh, here we go.
Yeah.
So that's the school that one of the schools that I belong to. So that's the unswitching procedure that we use. It's a bit loud, isn't it? Is the sound coming from here?
Lower it.
Shall I start it again and talk you through some of it? A few nods. Can I start from the beginning? Okay. That's just one of the handbooks. So we start with what's called an unswitching procedure. So this is making contact with specific acupressure points on significant meridians. And it's making sure that I'm working with your whole body when I start work. So these are muscle reflex. Oh, this is gait testing actually. So that's testing the function of the body. That's a muscle reflex test, the psoas muscle, one of your core muscles here. There's our pectoral muscles that we're testing here. That's the draw test, testing the anterior cruciate ligament. And this is an actual psoas release, so we're releasing the psoas into the top of the femur head there, giving you movement in your hip. And that's a hip circumduction, so you're moving the leg through its full range for your client. Testing FHL, functional hallux longus. This is called a plough, very good for any lower back problems. And then we do a 12th rib release. This is around this area here. We like to use triangulation, so we're looking for 3 points on our tensegrity zone to bring the client back to your balance. Just doing an arm release, releasing the shoulder. And this is part of the cranial balancing, so she's got hold of the sphenoid of the foot. So that's the final, almost the final part, is the cranial work. So consolidating everything at the end. Because eventually everything comes up the body and it affects the head. Okay, that looks like that. So I just thought I'd take you through the Amatsu training. It is really fun. We have a lot of fun learning. It's very physical learning. Learning the anatomy and physiology. It's just amazing. We had swimming hats on and putting all the bones on the skull. In fact, Jane, I don't think, no, she's not on any of these pictures. She's actually just published a book, Learning Anatomy. And this is a spine here. So these are transverse processes of the spine. And we're just figuring out how the spine works as a whole. So we made a caterpillar, it's a real understanding. So there's 4 years in the training process. The first year is anima massage, where we learn about just the muscles and the bones in the body. So anima translates as push-pull. So it really describes massage, doesn't it? Pushing and pulling various parts of the body. And we use other movements as well, other ones I'm sure you would know, and all of these things. So we learn a lot of massage in the first year, and you can make really massive structural changes using massage, as you probably are aware of. So you do have some anima practitioners around, so they've only done the first year, but it's a bug. It got me anyway. So the second year is called Seitai, and this is where we do these structural adjustments. So we add the ligaments onto our knowledge of muscles and bones. And the ligaments in your body, in all the joints, they're actually your pattern setters. They actually set the pattern of the joint. So if you don't work with the ligaments, the muscles are the large movements, the muscles would always be fighting with the imbalance in the ligaments. So you're getting a much deeper connection working with ligaments. And then moving on to year 3 is these are Japanese words, shinden, and that's anna massage to the viscera, so to all your organs, all your soft tissues in this soft bit here. It sounds awful, but actually it's nothing. We're not actually squashing or pressing or anything with organs. We're actually making space around the individual organs so that they can function to their greatest efficiency. So essentially you're working in the same way that you would work in year 2, but just with a different head on, a different intent, a different understanding of the body. So again, it's a deeper knowledge and a deeper correction. And then year 4 is Kenku, and that's our cranial balancing. So you then become involved with the cranial sacral motion of the body and balancing the occiput with the sacrum. So you're really integrating the whole body. And that was the year that I just found phenomenally exciting, because quite a few of the clients that I was keeping them going and we were improving and everything, but it turned out that the final part of the picture, the puzzle, was actually in the cranium, and actually making some of the cranial adjustments that I've been able to make has been amazing. Working with people with tinnitus and changes people's moods, and it's just amazing.
Do you have some success with that?
Yes.
Tinnitus?
Yes. Yeah, it really depends what's caused the tinnitus, and how long they've had it. But when I was working in just in my second year, I did actually manage to cure a man of tinnitus. I had no idea how I'd done it. But even in the second year, you're still doing your little bit of cranial balancing at the very end, but just without any knowledge or understanding. You add the knowledge and the understanding, and you're actually working with the temporal bone where the ear is housed, and you can change the balance of all those little bones in there. I'm not that good yet, I have to say. But often they're not big things that are causing people a problem with tinnitus. I've just been awarded a Sokotsu certificate, which is the master level. So it's a master practitioner, master Amatsu practitioner. So I'm very, very pleased with that over the years. So I think that's the end of my talk that I put together for you. It's actually 9:05. So do people want to have a break?
Yes.
I think a good time,
Yes.
let's get the kettle boiled and
Get the kettle
be a good
boiled.
time to have a
Okay.
break. And then perhaps try and sort of get back for about 9:30. And then
Okay, so
we've
I'm
got
going to either do
demonstration and a
questions,
bit of question
Yeah,
and answer. Or we could
if
do
you're
some,
willing.
we could do some question and answer.
Yes. Yes. So,
Do anyone have any?
lovely assistant. So we always start with what's called, it's an unswitching procedure. Oh, just take a pen out from there. Thank you. You haven't got your phone in your pocket or anything like that, have you? No. Or keys? No. Or hankies? Yeah. When I have male clients, I have to remember just to, empty their pockets. So we're making a connection with specific acupressure points. So anyone who's had any acupuncture, this is on the central meridian and the governing meridian, so really significant. We've got a couple of, so these 2 points here are where your collarbones meet your sternum. Now these are kidney points, K27. But what I found actually is that, well, not necessarily me, but the significant part, under every really important acupressure point, there's a really significant bit of anatomy as well. So if the joint between your collarbones and your sternum is not correctly aligned, your shoulders are not going to work well, your breathing's not going to be good because your sternum's not in the right place, and it affects the ribs, so it can affect the spleen, pancreas, the liver, all sorts of. So this side we've got a spleen pancreas point here. So we're just sending energy through these, and I'm just going with the flow of the body, the movement in the body. So I'm connecting with. So this is what I mean by it looks like, watching paint dries. Doesn't it? So we do both sides.
When you say you're sending energy between the 2
I
points...
don't know what I'm doing. I don't work with energy, Tim. I've got no...
But you do?
Well, I suspect I do unknowingly, so I'm quite keen to have a look at Reiki, actually.
So, what's the root of this energy? Is that energy going through you, or is it going through his body? To these 2 points? The shortest distance, in other words.
I've got no idea if it's energy. In my simple mind, because I've come from a very sciencey background, I did science A-levels, so I've come from a very sciencey background. And for me, I kind of look at this as I'm connecting with his body, top and bottom, left and right, front and back, so that when I start work, I'm working with a whole body, a body that's connected, and I'm talking to it. I've made a connection, and I'm not just poking him here, I'm actually really connecting with his tissue. What does that feel like? It's nothing really, maybe doesn't even know I'm there, sort of things. But not uncomfortable.
So the body is sort of allowing you to go.
Yes, it's because of the tissue rapport that we're taught.
Yes.
So I'm not, because if I just poke,
Yes.
His body will reject it.
Yes.
It just, it's an attack. It's aggressive. Yes. So I'm sneaking in like a ninja. I suppose. That's how we've been taught. So they've got top and bottom lip. The next point. So I'm actually moving with his motion, with his. I can feel torsions in his body underneath, and I can feel that in my body. So it's translating into where I am. But of course you can't really see it, can you? And I can feel when that has finished. When we were being taught. Initially, they were saying, you have to do this, and it was really just to get us moving. And then as you move on, you understand it's not that at all. And the way you know when you've finished, it's like when you get hold of a child's hand when you're walking across the road, or if you're teaching your child to ride on a bike or something like that. You know when they've got it, don't you? And I don't. It's something that we know in our body, and it's something that develops over years of practice, really. And So the next 2 points are coccyx and belly button. So obviously, they're very significant points for our structure. So, and again, I'm just melding and making contact with his body. And I'm actually making changes even at this point. So my first touch in my treatment, I'm already making changes. So if this was the only thing I did, he would feel better anyway. So it's a way of, we're neurologically organising our client. So actually taking away all the adaptations so that I'm working with a clean body, and the injured bit then comes to the surface and I know what I'm working with. So that's my top and bottom, left and right. We then do a polarity, so it's an extra bit of switching. Our bodies work on piezoelectricity. Is that something you've come across?
Like in lighters.
Is it?
Like the spark is a piezo.
Is it? It's the same.
Yeah, electricity resulting from pressure and various things.
Yeah, so that's how we get all our nervous impulses work on this piezoelectricity. So when you're walking, you're going to have a left and a right and a left and a right and a left, and it's constantly changing, positive, negative, positive, negative. So we're just making contact with the body and figuring out which is our priority side. So we break the body down into quartiles. So I'm looking to find left or right now. So it's the same thing, just making the connection with these acupressure points. So we've got lung 1 up here, which is obviously significant, and another spleen pancreas point down there. So we do this a few times, just so he thinks he's walking. And then we test. So this is a muscle reflex test, and I'm going, is this okay for your body? So this is where have you come across these before?
Like kinesiology.
Yes, so kinesiology tests, that's exactly what it is. But because of the taijutsu and the way we're taught, we don't do muscle testing at all like kinesiologists. We're not looking for the strength of the muscle, we're actually just looking for that reflex. So, does it attach? And that one, so this one doesn't. But it's difficult for me to demonstrate actually, because, let's see, if you can hold it there, I don't really like to explain muscle testing because it's very innate and people just do it automatically, and the more I talk about it, the less they're able to do it because they try and work with it. But he can hold that there quite happily. And if I touch a part of his body that is one of his bits that I know, he can't hold that now. That's very easy for me to move, very easy. And if I let go, so I'm saying, is this okay for your body? And he goes, no, I can't do that. And then it's fine. And it also works with, if you have a bad thought, your body structure changes immediately and everything. You can't, your body posture is very different if you're in a happy place. You feel very different and your body posture is very different. As soon as you go to an unpleasant place, your whole body changes. And so that's what we're working with, really. So we do left, right, and I find my priority side. So the weak side is my priority side. It's not weak as in not strong. It's the strong indicator muscle that you can't hold. So, and then we do what's called a heel tap. So it's a tap on the bottom of the heel, sending energy through his centre to his opposite shoulder. And the idea is just sending energy into the body, really waking the whole system up. It's like when you get your duvet in the morning, you just give it a good shake. And most people like this. So So, and again, we're using taijutsu. And this is, doesn't sound good, does it, that one? And you get a real sort of reverberation through the body, and see what this one sounds like. So can you, I don't know if anyone heard the difference between those two. So this one sounds like it's got life and movement, doesn't it? And this one just went thud.
Yes.
So, you know, again, that gives me information. It's interesting it's on the same side, but that would give me an indication that there's some problem with his shock absorbency in his ankle, his knee, or his hip. And we can work out which one it is by prioritising each of those areas. So that gives me information. So that's my unswitching. The next part of my assessment is always to, well, I suppose I've developed my own system really, but I get a hold of his, the talus bone here, well his in particular, my client. And the talus bone is one of our gyroscopic bones. It's not attached to any other bone. It's not articulating with any other bone. It's a free-floating bone, like the, what's this one called, the hyoid bone up here. And from here, I can, because it's free-floating, it reacts to all the torsions and tensions in his body, and I can feel as you get more and more experience, you can feel more and more. So when I started off with this, I couldn't feel anything. Nothing at all. Nothing at all. And I just, you know, I just keep doing it. But you can, and then one day I felt it, I went, you know, I actually felt it in my body. I could actually feel what's going on. And I could only ever get as far as the pelvis. But that was okay, because all I need to do is actually correct the pelvis to start with. So, it's very similar to, so if I put Brendan's hand on there, for example, there's, if I pull from here, you can feel that, can't you? You know where that pull, you can have an idea of where that pull is coming from, and you can try it yourself. If I pull from here, you can feel where that pull is coming from too. So that's what we're sort of, so if I've got a pull, two pulls, that's a little bit more complex, but that's what we're feeling in the body, in this space here, just down here. And what I can feel is, so Brendan's, his pelvis is tilted like that, and his shoulders coming over like that. That's familiar anyway. You can feel torsions on the knees, so you can feel the movements of people who've got knee problems. So I can't remember, when did you have your last balance? I can't remember. Oh, it was this week, wasn't it? Tuesday, yes, it's actually quite good shape. So the next thing is to see how the pelvis is out of balance, and we're looking for a fossa, which is a gap. There's actually a gap between the sacrum and the ilium bones, you know, where that comes in at S2, sacrum 2. So you can have if the sacrum, either the sacrum will be twisted, I have to explain this, either so if you imagine this is a hip bone and this is a sacrum here, either the sacrum will be twisted or the ilium will be twisted, so you get a gap at the top. Or if the sacrum is twisted this way, or the ilium is twisted the other way, you get a gap at the bottom. So you can have an upper or lower on either side. So again, we find the inguinal ligament, which is from the top of the hip bone to the pelvic bone. To be very careful working with men. Or actually either, you know, if men are working with women as well, because this is a very, you know, personal area, isn't it? So you're making contact with that and you're going, is that okay for you? And that is okay for him. And is this okay for you? And this is not okay for him. So that's how we assess, because the inguinal ligament will be pulled, so we see the pelvis is out in any, if it's torsioned in any way. So then we're going to look for the my points of critical change, my Kyushu. Well, actually, no, I do some muscle tests. So the muscle tests that she did in the little video clip, and this would be one that I would do on everybody unless they've got particular back issues or they're a very old person. Although I have got some sort of well over 90-year-old clients who do yoga and Pilates and all sorts, and they're very flexible and they can do all of these. So it's according to your client. But I want to know if the psoas muscle is functioning and which one isn't. So that's one of you gyro. So the psoas muscle joins from 12th vertebra down through the lumbar spine. Okay, yes. Down through the lumbar spine. Then it comes through your centre of your body, through your torso, and it joins the top of your inner thigh here. So it's a muscle which is a really, really important structural muscle because it's joining top and bottom, left and right because it's either side of the spine, which is your centre, and front and back. So for us, that's a core of my being. So every client goes out of my clinic with 2 functioning psoas muscles, whatever. And I can, if they can't do the muscle test, so what I'm doing with the muscle test is I'm bringing the origin, so 12th rib, 12th vertebra, and the insertion closer together. So I'm shortening the muscle, and it is in this direction because the psoas muscle comes through at an angle. And I'm asking the muscle to do its job, and that's all I'm asking it to do, and this one can't at all. So, and then on the other side, can it do its job? And that one can't either. So, interestingly then, so bilateral psoas muscles, that would point me to the occiput being fixed. It's one of those interesting connections. So, I would maybe prioritise one or the other. That's getting a little bit too technical, isn't it? So, muscle testing. So that's significant. With the psoas muscle, you've got your kidneys sitting on the psoas. So every time you're walking, you're flipping your kidneys, giving them energy. Your kidneys love being flipped because they just hang, don't they, from those ureters. They're hanging and they just rest on the psoas muscle and they love energy. And so if your psoas muscles are not working, you're not walking well, you're not getting energy into your kidneys. So that's obviously a significant health issue. The psoas muscle, in terms of like correcting something like that, I would go from the furthest point. So I'd have to figure out if he was a cranial priority or a foot priority, a foundation priority. So cranially I'd be working at the occiput, which is at the base of the head here. And down here I'd be working at the navicular bone, which is in the arch of the foot. A lot of people have dropped arches, so that the psoas muscle can't actually, if you're standing, if you raise your arches, the psoas muscle actually connects. You can actually feel that happen. So this is a really great place for a correction. And we always work with the feet. Always. Oh gosh, it's 10:15. I could talk forever on this. I haven't actually shown you very much, have I? At all.
It's a taster.
Yes.
One thing I would like to ask is about the skin drag.
Yes. Yeah.
Just what does that look like?
It really just looks like this.
Yeah.
So I'm just making, skin drag really comes in when I'm actually doing a correction. So you're making I'm picking up his arm, So I'm not grabbing, I'm skin dragging into that place. So I know already there's somewhere there that I need to correct in my correction, so it's there. So I actually get hold of that skin drag on his hand, and then I can feel which way this is torsioning, and then I'm looking for my next point. So there's a skin drag just here, it's on the top here on this side. So Brendan actually works a lot on a mouse with a computer. So he's often got things like this going on. So these two bones here, which I've forgotten what they're called.
Radius and ulnar.
Radius and ulnar, thank you. When your arm is parallel like this, when it's in its good anatomical position, these two bones are parallel to each other. So there's no torsions through this interosseous tissue. But as soon as you turn it, you've got a twist here. I'm seeing a lot of people with
tennis elbow.
Yeah, problems because of these the mouse and the keyboard thing. Yeah, this is big now. And so you're setting up torsions in the interosseous tissue in here. So you find a lot of skin drag in this area around here. Yeah.
That was useful just to see just what happened when you do the skin drag aspect of
and
things.
sort of very, I mean, did you work with skin drag or not? I can't remember. If you find a place that stops, don't you?
Skin drag, but you can feel a different sensation usually where there's a problem underneath.
Exactly. Yeah. So healthy tissue is a bounce. It has a bounce to it. It has a sort of really alive feeling. And it's very different than touching a tabletop that you know isn't alive. And so when you come to one of these places, it feels wrong, doesn't it? It just feels wrong.
Yeah.
So what it is, in terms of like Amatsu terms, we are omnidirectional creatures. And we move in all directions. So all of us needs to be able to be omnidirectional. So these places where there's skin drag is where we've lost our omnidirectional movement. So we're trying to give it back its potential movement. And if that is stopping, if that's not moving well, then the rest of the body has to adapt around that movement.